Hello everyone, welcome to NYC Health and Hospitals Kings County YouTube podcast. I am Dr. Mary Mallappallil, Director of Service for Nephrology and the Medical Director of the Hemodialysis Unit here at Kings County. Kings County has one of the oldest hemodialysis centers in the world and one of the first federally funded hemodialysis units. Today we will be talking about optimal hemodialysis. With me, I have Dr. Sandeep Sasidharan, a nephrologist, Ms. Elsa Crick, our ADN, Ms. Phoebe Carsula, our head nurse, and Ms. Theresa Brereton, a registered dietitian. My first question goes to Dr. Sasidharan. What is the most important element in diet that needs to be controlled in a patient on hemodialysis?
Well, Dr. Mallappallil, one of the most critical elements in a dialysis patient diet is potassium. We closely monitor potassium intake, use binders, and consider any residual urine output. Patients on particular medication need extra attention to keep their potassium levels in check. There is going to be a book coming out soon about nutrition in kidney patients, which people may find useful.
Besides potassium, my next question goes to Ms. Crick. How is fluid best managed in a patient on dialysis?
Thank you very much, Dr. Mallappallil, for that question. Checking your weight before dialysis lets your care team know how much fluid needs to be removed during your dialysis session. After your dialysis session, you will need to get back on the scale again to see how much fluid was removed. Your weight when you're not holding fluid is called your dry weight or target weight. Ideal amount of fluid that should be removed is 10 ml per kilogram an hour on dialysis. So, a 70 kilogram patient on a 3-hour dialysis treatment would have about 2 liters removed over a dialysis session. Each liter of fluid weighs a little over 2 pounds.
That sounds like a complex calculation. What happens if too much fluid is removed from a patient during a session?
Removing excess fluid can be very uncomfortable. Patients can experience a sudden drop in blood pressure, which usually occurs at the end of the dialysis session. You may feel nauseated, weak, and tired because your body may not be used to having fluid removed so much at once. You can have cramps and cardiac stunning, which is tightening of the muscles or arteries that send blood to the heart.
Is there a safer way that we remove fluid here at Kings County during dialysis?
There is a safer way to remove fluids. If you have excess fluid or fluid overload, your care team may order extra dialysis sessions to get your fluid back to your normal levels and prevent trips to the hospital. We at Kings County Hemodialysis ensure that our patients' fluid volume is controlled by offering the extra hemodialysis sessions as needed to keep them safe.
Thank you, Ms. Crick. That sounds very complex. Dr. Sasidharan, could you talk about what happens if there's too much fluid in the body?
Yes. Excess fluid can lead to complications like pulmonary edema, which is a fluid buildup in the lungs, which can be life-threatening for the patients on dialysis. From the patient's perspective, they could feel like they're drowning when this happens. It is essential for us to get the right balance when it comes to fluids.
Besides fluids, what are the other elements that are important in diet? Ms. Brereton, could you comment on that?
Absolutely. Your diet is an integral part of your dialysis care. Today, we will focus on 2 elements of the diet. The first one is sodium, which is a mineral found naturally in foods. Eating too much sodium can make you thirsty and cause your body to hold on to more fluid. The extra sodium and fluid can cause swelling, puffiness around the eyes, swelling of the hands or feet, fluid weight gain, shortness of breath, rise in blood pressure, and create more work for the heart. So it's important for you to follow your recommended sodium allowance, but give yourself time to adjust to the flavor of less salt on foods. Learn to flavor your foods with herbs and spices instead of table salt. Do not use salt substitutes containing potassium unless approved by your healthcare professional. The next element is phosphorus. Phosphorus is a mineral found in all foods, and large amounts of phosphorus are found in products like dairy products, cheese, canned milk, ice cream, pudding, nuts, dried beans like kidney beans, lentils, beverages such as cocoa, beer, and even dark cola drinks, convenience food, processed food with phosphorus-containing food additives such as chicken nuggets, hot dogs, refrigerated baked products, and some beverages. So eating foods high in phosphorus will raise the amount of phosphorus in your blood. However, phosphorus from plant foods is less absorbed than phosphorus from animal foods or phosphorus additives. Dialysis cannot and will not remove all the phosphorus in your blood. So when phosphorus builds up in your blood, calcium is pulled from the bones, and over time your bones become weak and brittle. Phosphorus in your blood may cause calcium phosphorus crystals to build up in your joints, muscles, your skin, blood vessels, and your heart. So these deposits may cause serious problems such as bone pain, damage to the heart and other organs, poor blood circulation, and skin ulcers. So to keep phosphorus at safe levels, you will need to limit phosphorus foods, and you may need to take a medicine called a phosphate binder. It's important that you take the binders with your meals and snacks. So here is a tip for you. Using foods instead of processed foods or convenience foods is a good way to lower the amount of phosphorus in your diet. Read your nutrition labels to look for the word phosphorus or a shortened term, PHOS, in the ingredients of processed foods.
Thank you, Ms. Brereton. That's a lot of information. Now, besides the food and fluid, what else can be done to stay well on dialysis? Ms. Carsula, could you comment?
Yes, Dr. Mallappallil. Preventing infection is one of the quality of life indicators for a good hemodialysis. Hemodialysis patients need an access created. This way, the blood can be accessed to go to tubes connected to a filter on a dialysis machine and then come back to the body cleaned with less fluid. There are basically two types of hemodialysis access. One type of access is a catheter. It's a tube inserted to a vein in the chest connected to the heart. This is the fastest way to access the blood for dialysis, but it is very prone to infection. The other type of access is called a fistula or a graft. It is created inside the non-dominant arm of the patient. This type of access takes time to mature, at least 6 weeks. Unlike the catheter, a fistula is not exposed to the environment, so there is less chance of getting infected. Infection prevention is utmost importance, with these accesses being used for hemodialysis 3 times a week. We either convert a catheter to a graft or fistula within 90 days, or we can ideally start a patient on dialysis with a matured fistula. At NYC Health and Hospitals Kings County, our nephrologists refer our hemodialysis patients for testing to be candidates for kidney transplant. There are many transplant centers in New York which patients can choose from.
That sounds like a lot of information for optimal hemodialysis. Thank you for joining us for this episode. And for this season, stay well.